most famous physical therapist on the internet.
Only if you
Hi,
are.
folks. I'm Bob Short, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about how to know if you have a serious knee injury or problem. Now, this could be after an injury or it could be just over time.
Right, right. The aging process, which we know about.
Right, we're well
unfortunately.
aware of. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com, go to the giveaway section because we're always giving something away. And this week we are giving away a mattress, a Sleepovation mattress. And we'll show you this just a second.
Sure.
You go to Facebook. It'll be pinned to the top of the page. Go to Instagram, Twitter, or TikTok if you want a 60-second version of our program. This is a Sleepovation mattress. It's only a sample. Yours is bigger. Yours would be bigger. We got the sheet the cover.
The cover,
away,
yeah.
pulled away.
Nice.
So you can see the 700 individual mattresses.
Say no more, Bob.
It's got air channels. It's very comfortable.
As a matter of fact, I'm going to take a nap on this after we're done.
Yeah, it's very good for pain control. All right, so let's go with number one, Brad.
Oh, back to the knee, yes.
Yeah. One, you just see you can't even bear weight on the leg. That's not a good sign.
Right. That's most people are going to figure that out, but there's some people, particularly some guys, it's just
I'm gonna tough it out.
You know, it's like it's just a flesh wound, no big deal. Get better. Well, you might make it worse.
That's an old saying, just like flesh wound. Number two, it's really swollen, especially after not just we're not talking about little swelling around the kneecap or something like that. I mean, it really swelled up.
It starts to look like that balloon, so to speak.
Right.
You've got to pay attention.
There you may have a ligament injury or the patella maybe slid out of place. It's number three. You see an obvious deformity. Now, this is one I think people would probably go in if they see the knees kind of up.
Yeah, you say your kneecap is over on the side,
or your bone is kind of hooked off to the side.
Yeah, so pay attention to that.
That's pretty obvious. Okay, number four. It feels like the knee buckles or gives way. Like a lot of times, it may even feel like the shin bone is shifting.
Oh, yeah.
Like what you have with an ACL injury.
Yeah. Or you have that thing where it's like, you get that. It's like, what happened? It just gives out.
Right. Exactly. Knee buckles. So number five, excessive bruising, especially like you might have a quadricep or hamstring tear and down near the knee.
Particularly if there's not a obvious reason, like you fell on the ice. That's one thing, but you may strain a muscle and actually get some of that ecchymosis or that bruising color from muscle being tore.
Just generally as a rule of thumb, the more ecchymosis
or black and blue
that you see,
color.
Usually the worse the injury was.
Sure.
Because you tore a lot of blood vessels in you. All right, number six, you can't flatten the knee. You can't straighten it all the way out.
Yeah.
It feels blocked.
Yeah, it won't go down like it's supposed to, and it always used to. And it's like, oftentimes there may be pain associated with that.
Sometimes it's swelling, but sometimes it could be your cartilage got tore and flipped a little bit.
Yep, your meniscus injury.
And it's blocking the movement. You can't bend the knee. It would be the same thing.
Yep.
It could be cartilage, but you can compare the two. You can bend your one knee.
This one goes way up here, and this one stops. Yeah. Usually there's pain associated at the end range with both of those. Typical with a meniscus problem.
Number eight, your knee gets stuck or it kind of catches. When you're walking. Yep, locks up. Number nine, you have what am I reading here, Brad? You have pain in addition to redness and swelling in your knee. So this we're worried about infection.
Right.
So you have pain, but you have redness and swelling, and
particularly if you've had a knee replacement, and there's no reason for it.
This was my mother-in-law.
Sure.
Went into the clinic 3 times before they diagnosed it.
Oh, really?
No, to a hospital 3 times. And they didn't even diagnose it there. They diagnosed it at another hospital, and they diagnosed it with
she had infection?
10 seconds.
Oh,
yeah. So I don't know. All right, number 10, final one. The pain is just not getting better, or it's getting worse.
So a constant ache that goes on for, 2 or 3 weeks, and there's nothing that obviously makes it worse or better, and it's just hanging on there.
Yeah, especially like night pain. If you're,
yeah.
yeah, you always want to get things like that checked out. Short video, Brad. This might be a
Well,
record for us.
Wow, 5:05. We could keep babbling for a while.
Yeah.
See what happens.
No, we'll stop for once. Remember, Brad and I can fix just about anything.
Except for,
Broken heart.
but we're working on it.
All right.
Absolutely.
Glad to
We
see that.
continue to persevere.